Okay, James, I'm going to do your physical exam. For me. I'll just take that from you. All right, first I'm just looking at overall appearance, making sure that James' color is good. And I want to just take a look at your hands. Hands are warm, nail beds are pink, there's no clubbing. Checking the radial pulses. Strong and equal bilaterally at 2+. You can also check the brachial pulses, which are more difficult to palpate, but fine. And checking the epitrochlear nodes for any node enlargement. There is not any. Okay, then I would like to just feel skin all the way up to the shoulder. I don't see any lesions, no abnormal venous pattern, no swelling. I'm going to just do the Allen test to just check for arterial insufficiency. So including both arteries. Go ahead and pump your hand open and closed a couple of times. Okay, that's good. Now relax your hand. All right, you're good. Now do that again. All right, good. And other arm. Same thing. Pump your hand back and forth. Here. And open your hand.
Other things that you should ask about are physical demands.
Okay.
So is he, do you like to work
good.
out?
Good venous return there. All right.
Any other
I'm going to take a look at your carotid artery. I don't see any pulsation there. I'm going to just palpate one side at a time. Rate, rhythm, and amplitude. Strong and equal bilaterally. Listen for bruise.
Exercise. So we got there's a little bit that like he walked his dog. How often does he walk his dog? How far?
I don't hear any bruise. Then I'm going to do the lung exam first. So I'm going to actually notice AP diameter on the way around. Looks great. All right, take a deep breath for me. Expansion is symmetrical. I'm going to put hands on you. Take another deep breath. All right, good expansion there. I'm going to listen. I would like you to take these deep breaths in through your mouth.
Yeah. So we're really, when we're thinking about the visit, 20 visits, I would say like 15 minutes spent on history. That's really, I think of like history
and relax your legs. I'm going to feel for your pulses. So first I'm feeling for the femoral pulse on the right and left side.
Okay, on to the physical exam.
Okay, great. Come around the front.
I know. Okay. So great job of assessing his general appearance. How does he look? Is he
Listen to your legs in the front.
Is he in distress? I want to look at germs. So having him take off his clothes, looking specifically at his chest. Do you notice any rashes? And you're probably doing that. And as you were assessing him, you specifically called that out for me, so I know. Okay.
Bilaterally.
With the lungs, you also have for breath sounds. Great. You also
Right. Now listen to your heart next.
for symmetry, looking for deep
Breathe
breathing.
normally.
You did an excellent cardiovascular exam. That was great.
Hold on.
With MSW, one specifically palpating the chest wall. And so you were palpating his throat, like great job with that. I'm palpating, so we're palpating along your costo, angle, or the cervix there. You see the chest. Just like a general. It's like a cheesy, like grip on your entire, back.
I just had a question, and I'm sorry, I'm trying to share time, but like, when would you, start inquiring about like
Great. All right, and then I'm going to listen for blues in your renal arteries while I have you sit here. Is that going to be a little bit better position to listen?
Only if you have any tenderness when it comes in palpitating.
And I do not hear it. Okay, that's great.
yeah, I just
Okay, and then I'm going to have you move that. Put the head of the bed. I'll have you swing your legs up. And I'll check your jugular venous pressure. Tension there.
Did a good job of auscultating the mouth sounds. You auscultated the release of the arteries, but you listened with your diaphragm and your bell. So you want to flip that over?
and then I didn't know how we
Yeah.
Head up at about 45 degrees.
The upper abdomen as well. So this happened where his gallbladder is. This happened at the gastric vein.
All right, first of all, I'm going to have you just turn your head to the side so I can see if I can visualize any jugular venous pulsation. If I think maybe I would be a little worried about
You said very fastidious, so.
I'm really checking a little more
The technique,
down,
checking for very
flat.
fastidies, measuring
Not really seeing any, but if I did, this is how I would measure.
You did. Okay, so reports.
One at the sternal angle.
Great job with the
And the other?
HPI. What I noticed was that you incorporated just a little bit of physical exam. So you said,
So probably less than 1 centimeter is what I would have to say if there was any at all there. And then I'll do the abdominal jugular test.
He is
Putting
obese.
some pressure on your abdomen. Your head turned to the side there, so I can see
That's
if
more
there's
of a
any
physical exam.
raising that.
So you're going
I do
very
not see any.
systematically.
That's great. Put your head back down
What
again.
the subject is, and then you okay, yeah, combine the two.
Going for a low
The
ride.
great review with the HPI, but their uses is just a little bit more detailed. You said negative findings
Okay,
in.
first observing the chest, making sure that there's not any increased work of breathing, there's no
He doesn't have fever or weight
heaves or lifts on the chest, I don't see any. And I'm actually going to palpate with my fingers.
Palpitations, paroxysmal maternal
See if I can feel any.
GERD, heartburn, no anxiety. So
Same
these
areas.
very, like, the most essential things so that the receptor will know that you thought about those. And that,
And while I'm here, I'm just checking for musculoskeletal. You know if any of that hurts. So I'm checking over the ribs and where they hit the sternum. Because I'm concerned about, based on the history of either musculoskeletal
significant history.
as an origin for the chief's complaint. So that's why I'm checking that. All right. Then I'm going to just listen a little bit more to the heart. So I'm going to listen with the bell
There's lots of work.
and check for
You will get there, yeah. I mean, you have the next 4 quarters, right? Yeah. I mean, this quarter is
so again,
hold on
pulmonic,
This is a particular time to work together too.
tricuspid,
Absolutely.
and
This is a
mitral.
brand new skill, guys. This really is. I know that
Urinary today. Okay, and I'm going to turn a little bit onto your left side.
So that's why they were going through this. And I'm sorry, it's intimidating. I know it feels like it feels like
Just feeling for pulmonary
you guys are
should be about
you're where I would. Okay.
and if I need to, I can have her roll onto her left side to get that chest, the heart rhythm pushing.
Yeah. Keep up the good work.
All right. Now I'm going to just do a little bit of an abdominal exam. First, noticing the abdomen, looking at the color, venous pattern, any scars, striae, lesions, not seeing anything looks flat and normal color. And then
Well, I haven't done my,
you take a listen to see if I've got vowel tones. And I am hearing vowel tones. I also want to listen for blues.
2 minutes into
Okay, sorry, I got
stop recording for some reason. So I was thinking I could record it, but like I just wanted to see what you I mean, thankfully, it
I'm going to
was
palpate the abdomen.
watch, and I have all my notes, but I just wasn't sure.
Palpate each quadrant. Let me know if you feel any pain or tenderness. I'm not noticing any.
I caught it in time before I did my physical, because there was this reamer black, and I started it, and I got
So feel a little bit lateral to each there.
I think it's going to be really
Feels like appropriate size for. Okay, then I'm going to move to
Okay, I
lower
got that.
extremities. I'm going to start with palpating femoral pulses.
watching yourself.
Those are 2 plus bilaterally. Then I'll try popliteal. Those are pretty deep. For bender legs.
That's how you're doing student.
All right.
Yeah.
Good. And then the posterior tibial pulses.
I was like, I can redo it, but I just, okay.
And when did that start?
All right. Good. And then finally the dorsalis pedis. All right, and those are all 2 plus. That's great. And then listen for bruise in the femoral arteries.
When you say it came on gradually, when did you say you were coming on? A few days ago, weeks ago, months ago, years.
Okay, not hearing any there. Checking for edema over the feet. 5 seconds. Medial malleoli. Down there. And then over the shins.
I was just letting you know. So you were like,
And down there as well.
Came on yesterday.
Okay, you can have you stand up for me, please. Checking venous pattern of the legs. I've already checked the temperature of the skin, but I don't notice any varicosities. If I did, I would look at their color, redness, any other discoloration, and plugging for tenderness, pain. And now I'll just measure your ankles.
Okay, so you're going to give me reports, right?
yes.
I work in a warehouse. Okay. So that brings me into my next question. What kind of things make it better or worse?
Same on each. Hinge over 20, maybe 20.5. And I think that that's it.